Hello and welcome to IHW Council's week-long health campaign, Blindness Prevention Week 2023. Prevention of Blindness Week is observed by the Government of India between 1st and 7th of April every year. Many people might take this beautiful world for granted. Maybe this colorful world is normalized for us, or in our daily lives, hustle and bustle. We might have forgotten to appreciate the natural beauty around us, but not all amongst us are that fortunate. As per the World Health Organization, there are around 40 million people in this world who are blind. India is home to one of the largest numbers of visually impaired persons. Did you know that in majority of such cases, blindness is preventable and it is not always related to genetics? Today, we will be discussing lifestyle interventions to prevent visual impairment. It gives me immense pleasure to introduce to all of you our eminent dignitaries who are joining us for this session. Please welcome Dr. Anita Sethi, Director, Department of Ophthalmology, Fortis Memorial Research Institute, Gurugram. Dr. Jolly Rothgi, HOD, Ophthalmology, GDB Hospital. Dr. Mahantesh G. Kivarasnar, the founder and chairman of Samarthanam International, President Cricket Association for the Blind in India. We will shortly be joined by a few other dignitaries, which include Dr. S.Y. Qureshi, former Chief Election Commissioner of India and the Honorary Chairman, Sight Savers India, and Ms. Tiffany Brad, social worker and founder, Jyotirgamaya Foundation. Thank you all for joining us. It's a pleasure to have you with us. Let me start with you, Dr. Mahantesh. Visual impairment is usually considered the result of advancing age and genetics. How does one's lifestyle impact eyesight? And in India, according to what you've seen in your practice, is it just genetics and age that is responsible for visual impairment?
Thank you, madam. So, not necessarily actually. There are many other reasons, depending on the lifestyle, could contribute for the blindness. By and large, congenital hereditary blindness or born blindness is there. But there are many ways we can limit people from becoming blind and also delay or prevent becoming blindness. So like what you rightly mentioned about the lifestyle. So in daily living, if we can adopt certain practices, we can avoid, we can prevent blindness. We can also prevent the reduction of blindness. For some people, they suddenly lose vision. Some people gradually lose vision. Those who gradually lose could be delayed. Probably doctors would be in a better position to talk about it. But as far as common man, because I started Samarthanam and have been living in school for the blind from school days. So I have seen so many coming to my school and subsequently to Samarthanam. They become visually impaired due to certain man-made issues, you can say. Like, I think we all need to really ensure we consume good quality of vitamin A, vegetables and greens and carrot and a whole lot of things that could really hold on to our sight well. And second one, if we have a bad history of visual impairment in the family, we got to be really careful. Go to doctor regularly, get our eyes screened. And thirdly, like we should avoid children playing from sharp items and make sure they wear eyeglasses when they are playing with sharp items or when they are doing some welding work or they're bursting crackers. So if people are with diabetes and cholesterol, they have to ensure they keep all this under control. So these are some important features one need to follow so that either they prevent fast reduction of sight or avoid eye injury. Like sometimes infections, they have to wear the glasses. If there is, we call Madras eye in South. I don't know what you call. Doctors will tell about it. So please stay away from such people And if someone is using contact lenses and specs, make sure before you take it out, clean your hands properly. And when you go for swimming, ensure the quality of water is good, or cover your, especially eyes, with the goggles. So like this, certain good practices are infused into the minds of children and adults, so that, because eye is a beautiful and important part of a body, to keep ourselves healthy, it is most important. So this is a very brief, I thought I could quickly share.
Right. Dr. Jolly, I want to come to you. Now, does India have special circumstances if we see such a large population of those who are visually impaired? Some people cite illiteracy, lack of knowledge of what's about health, diet, as one of the reasons why there's such a large population of visually impaired in our country. And other than poor nutrition, what are the other factors that lead to this visual impairment in our country?
See, basically the type of patients which we are getting, first is awareness. There is no awareness at all. And only when their condition has really deteriorated, they will come to an eye specialist. They usually in their village or town just keep going to the regular doctors and never come to us. Secondly, the problems which we have is that patients are also going to quacks, and there may be a lot of wrong use of drugs, especially for ulcers and all, and that really spoils their eye. And by the time they come to us, they are not, we can't do anything. The third is patients of glaucoma. See, patients of glaucoma, it is a disease which is silent in a lot of patients, and they do not really know that there is something like glaucoma. They do not know that they have to come for regular eye checkups. So that part is absolutely, totally missing. Though we do have a glaucoma awareness week where we do put up posters, but that is only for the patients who are coming to the hospital. So general public has no awareness, and the worst thing is their peers. They will say, okay, you are having poor vision. Wait till your cataract becomes mature, then you go and get surgery done. So that is a concept that every old person has a cataract. And in that way, we are missing lots and lots of other diseases which are preventable or treatable at the early stages. You see, something like glaucoma, something like retinal detachment, they are not treated early. If you are going to wait for the vision to go completely, then nothing is going to, we cannot save their eyes. So this is another problem. Children is the third thing, that there is no system of having a child seen before they go to school or in the before preschool age, because that is a very important age. And a lot of children with amblyopia, that means they have poor vision in one eye, they may have squint, they may have high glasses number, and they are not able to, by the time they go to school, then the school teacher will say, okay, your performance is not good. Then they will refer to ophthalmologist. So that lag period, in that lag period, we are not able to revive whatever vision they have lost due to amblyopia. So this is another such factor. And of course, there are many, many more. So,
Right. We will discuss these factors and, whether lifestyle interventions can help reduce visual impairment in our country. Dr. Renita, Dr. Jolly just spoke about young children. So let's just talk about young children for now, because visual impairment is something we think only happens to those who are old. But we are seeing young children wearing specs. And like Dr. Jolly said, sometimes, to just even figure out that a child needs specs, it's as late as school. And, now what has happened post-COVID in the lockdown, a lot of children were watching devices. There was no way out. They were really hooked onto the devices. And now we have something called the pandemic of myopia. What is this actually? What does this mean? And can this be reversed? Because these are very young children.
Yeah, I agree. I mean, most of the topics have been covered by the previous doctors, but this is something which is really troubling us because post COVID, we've had a large number of children, and these are children educated and not even don't even know what it must be like in the rural areas, but the urban area children. Now, the thing with the child is that they don't realize कि इससे better vision हो सकता है. They think that everybody is seeing like this. So post COVID, when the children went back to school, then the teachers were the ones who were picking up that this child is not looking at the board but copying it from their partner. And then so many children came to us because the teacher had sent them, and they would have huge errors, -3, -4, -8. So this is very worrying for us because as the child grows from the age of 5 to 18, as he grows, the power will increase. So an increase of 0.5 or 1 is a normal kind of an increase. But if the child is already starting at -5, we really don't know where that number is going to go. And the higher the number, the more chances of more myopia related complications like retinal detachment. There are so many more complications. So firstly, we would like the children not to have glasses, but we can't always control that. But we do want to prevent the number from jumping up. So there were a couple of things during COVID. One was the fact that the children were all the time on the screens, and even the leisure became screens. So, and that has continued. The lockdown is over, but still people are using their screens far too much. Secondly, there was no outdoor activity for the children. Studies have shown that 1 hour of outdoor activity, be it running, cycling, playing a game, has a good effect on the eye strain caused by this near work. So it's really important to make sure that the children play at least 1 hour a day outdoors, and wherever possible, decrease the screen time. In fact, the near screen time is worse than the television. If at all they have to do maybe half an hour of television, but the more they look down and closer they go, and many children घुस के पढ़ते हैं, all of that is just adding to the chance for the myopia to progress. So a good diet, as doctor has said, and this is more important in children. And I tell the children that once you are 18, kitne bhi kilo gajar ke khaoge, your number is not going to go away. So if you want to control it, it's a good diet now, good reading habits, good sleeping habits. All of these will work for you the best as a growing child. So these are really important. These are the modifications which you can make for your children to prevent the number from increasing as they are growing.
But Dr. Anita, can this be reversed? Because, you mentioned that, go outdoors, give your eyes a break, don't stare at the screen. So if my number has gone up to 3, as I grow up as a child, can that number come down?
It is very unlikely because this minus number is due to the increase in the axial length of your eye, which is not going to reverse. So yes, sometimes if there is a plus number, as the child grows, it can become 0. But a minus number to reverse is really, we are just trying to stop the progression. All the methods that we now use, like special glasses, special lenses, and all of these lifestyle modifications, is to prevent further progression or alarming progression. We cannot reverse numbers, so that's why the prevention is so important. Yes, we can correct it surgically once they're 19, 20, but we cannot reverse it. Of course, we won't tell the children that because then they won't listen to us at all. So, as you're educating them, we do have to tell them that chashme hat jayenge, because otherwise, wo hamari to koi nahi sunega.
Yes, that is a big problem. Dr. Mahantesh, you spoke about children getting injuries, etc. Now, this whole issue about screen time, about good diet, about like Dr. Nita said, sleeping properly, playing outdoors. Are you impressing upon children to do this? Are their parents aware of how critical this is?
Yeah, I think it is very, very important. We try to create awareness, as Madam was mentioning. We do work with a lot of schools which are not for the blind. We conduct a lot of camps, and we also educate them how important it is to maintain and take care of their eyes. And we also tell them that they have to go out and play and make sure they play safe. And especially in today's world, kids use mobile too much. So we try to sensitize them. We encourage them to play sports, especially in these schools. We provide them with playing items, cricket kits, football, and a few other sports items. And we also tell them that to the extent possible, they should not continuously stare at certain things, maximum 20 minutes, even it is mobile or watching TV, whatever. They should not watch it continuously. So they have to give a gap, they turn and give a gap of 20 seconds and close their eyes and again open and see. Like this, through certain play mechanisms, we try to educate them. And Samarthanam primarily works for people who are visually impaired. But there are kids who are partially blind. We try to restore whatever sight they have. But we strongly believe, yes, sight is very important. But if it is not there, if it is gone, they need not worry how technology can help. Artificial intelligence and all is there. So we try to build confidence in them. And whatever little sight is there, please restore it. Don't lose that. And those who are completely blind, we provide them support through technology, education, so that they are equally empowered and become taxpayers of the country. That's the whole purpose.
All right. Dr. Matish, we will discuss these new technologies and how they help the visually impaired later in the show. Dr. Jolly, I want to discuss about the kids, the children, little children only. You yourself mentioned that one of the reasons why visual impairment becomes as bad as it does is that, they come to you too late, because people think eyesight is an issue that people over 40 need to worry about. That's when they get reading glasses. That's when they get cataract. That's when they do something or they need to do something. Now, for children, they have a proper vaccination schedule. And if they are following this schedule, they will meet their doctor at regular intervals. But that doctor may not be doing an eye test. So do we need preventive eye checkups for children at regular intervals?
That is an ideal situation. If it is done, that will take care of a lot of diseases like amblyopia or children requiring glasses at an early stage, or having diseases. Even a child can have cataract, a child can have glaucoma, child can have squint. So all these things and some, of course, some developmental defects can also be there in children. So it is very important that the child is seen at the early stage. So it is not a bad idea that when they come for their vaccination, you can have one checkup at that time. At least we can have grossly that there is nothing wrong in the child. And one examination just before they go to school. And of course, once they enter school, then of course, regular examination should be there. So that is an ideal situation, which is not really being followed here in our country.
All right. Dr. Anita, not just children, I want to try to understand, is there an impact on visual health because of use of screen? Because, these days we all have to work on our laptops. We have to connect to our mobiles to stay in touch with work mails, with messages. We are honestly staring at a screen for many, many hours now. Other than children, does this yes, we are, even though technology is enabling this discussion. Does this lead to any impairment or impact on eye health? Is there anything that can be done to mitigate the effects?
I'm going to just add to what Dr. Jolly said. I think that's really a very good idea. In the private sector, many of the pediatricians will send the children just preschool for one eye checkup, and they do pick up squints and things like that and send them to us. I think it's much harder in the public hospitals because there are so many sick patients. Wellness checkup, though, is I think something which is very far. But like they do ROP, retinopathy of screening, the pediatricians, they always call in the ophthalmologist for that. So maybe if we can make the pediatricians more aware, or when they start school, they have to show their vaccination, certification. They should also have to get come from the ophthalmologist that the eyes for the age seem to be, appropriate. Or like when we get a driving license, I mean, if that were to be properly done and actually you get a eye check, that also is a good point to pick up things. So wherever there are these places where the certificates get checked, or at entry levels into school, into colleges, I think an eye checkup should be mandatory over there, because you can then pick up a lot of and prevent so many diseases. So coming to the adults, well, in the adults, yes, the prolonged screen time does cause some problems, but it doesn't cause, sort of blindness. It doesn't cause as much of an impairment as it does in children. We have found even young adults, I said the number should stabilize by 20, but post-COVID, because of this prolonged screen, and especially at night, in a dark room, just the light of the screen, it really gives a lot of strain, digital strain, and can actually, the number can still progress even in young adults. So it all boils down to judicious screen time, take breaks in between, be mindful of posture, posture, lighting. You're also going to save your neck from cervical spondylitis. And the other problem that we are facing, another pandemic of, is dry eye disease because of the prolonged screen time, blinking less. People are coming with tiredness, irritations, strain, and basically lack of lubrication of the eyes. And dry eye disease is not any one, it's not just the screen, it is also allergies which contribute, pollution which contributes. So there'll be a whole lot of factors, and finally you'll end up coming with burning eyes, pain in your eyes. So the screen is one of them, and I think the point I want to make is that firstly, everybody should try to decrease their screen time, increase their exercise. Increasing your exercise, there's no separate exercise for the eyes. Your body is healthy, your eyes will also be healthy. And you need to, when you have a problem, go to the doctor immediately. Don't wait, and don't, think that "Achha, theek ho jayega apne aap." It's always, and do not take medicines just over the counter from the chemist, because unfortunately in our country, kuch bhi mil sakta hai. And a lot of people give steroids, in the eyes, and that can lead to so many complications. So, I mean, on an aside, I would really like to highlight the misuse of steroids. Steroids in the eye can cause cataract, glaucoma. Steroids eaten can cause diabetes. So steroids are something which must be looked at very, very judiciously, especially in eyes.
Eyes from pollution in UV rays. But not many people take it seriously. You don't see everybody wearing dark glasses when they go out. How critical is that?
Your first question was about the
Dry eye.
So we are seeing lots and lots of young people coming with eye strain, and on questioning we get to know that it is the computer use which is caused. So a lot of them do have minor glasses number, which in a routine life they may not require. But if you are having a long time use of computer, you definitely need to correct that number. Otherwise, it will give you a lot of strain. So this is a small number. Second is that they have subclinical dry eyes. That means when you look at them, the eye look absolutely okay. But when we do some special test, we come to know, or their symptoms are suggestive of dryness. So nowadays, every young person coming with eye strain or headache, we are asking them about their computer time, how much time on the screen they are spending. And then we tell them something about how to, decrease that eye strain. And for that, we have, that screen size is important. From where the light is coming, light should not directly enter your eyes. Suppose background light. Suppose you are in a room, so the tube light should not be directly coming to your eyes, or there should not be a window behind your computer screen. where the reflection of the window will come on the screen, and that will also cause strain. Then in between, you have to take breaks. So every 20 minutes, it's something somebody has given this formula that every 20 minutes, look at a distance of 20 feet for 20 seconds, and then blink your eyes and then come back to your work. So just frequent breaks in between will help you decrease the strain. And then use of artificial teardrops. That is another important thing. For those who are symptomatic, I ask them to use artificial teardrops, or simply washing eyes in between with clean water. So that can all help. And of course, as Dr. Anita was saying, posture is very important because it can give you a neck strain. So to have a proper chair, proper desk, and to sit on it. So that way, computers or a screen is better than a mobile phone, because mobile you are using in different odd posture and causing a lot of strain to the eyes. Especially children, when the parents say don't look at the computer, this laptop, this mobile phone. So what they'll do is they'll put off the light, and in the bed, in odd posture, they are looking at the computer screen, and that causes a lot of eye strain. And maybe it is helping in increasing the epidemic of myopia in children. Your second question was?
The second question was on pollution and UV rays and the impact on eyes. Are people aware about this? I don't see many people wearing dark glasses when they go out. Does this impact visual health?
The UV light, I do not know how much people are aware. Most of the patients who are coming to us are not wearing their dark glasses. And there are certain diseases like cataract, macular degeneration, pterygium, and cancer around the skin of the eyelids. So these are some of the conditions which can result from excessive ultraviolet light. And this is the maximum light is from the sun. So that peak time is when the sun is right overhead, which is around 10 a.m. to maybe 2 p.m. or 3 p.m. So that is the time when the sun is on the straight above us and maximum UV light is coming. Then apart from that, you have these mercury lamps and UV light lamps, which are used for different professions. They can also get a high exposure to the ultraviolet light. And for that, you need to have wear glasses. Now, the routine glasses which are available in the market, you just go out, you see a lot of people sitting with dark glasses. They are not adequate because they may not be giving UV protection. So for UV protection, you have to see the glasses which are giving proper UV protection. Only those dark glasses are of help. And I read somewhere that maximum UV exposure is occurring before the age of 18 years. So that means even in children, it is very important to protect their eyes from sun and from UV light, because that is going to have a long-term effect on their eyes. Mm-hmm. And as far as pollution is concerned, we have a lot of pollution, and lots and lots of patients are on anti-allergic drugs because of this pollution, for which we do not know what we can do.
Mm-hmm. We're joined by Dr. Esma Qureshi as well. Thank you so much, Dr. Qureshi, for joining us. And I'm sure through your work at Sight Savers India, you are aware of, deeply aware of our ground situation when it comes to, visual impairment in our country. In your experience, sir, how much do lifestyle choices lead to visual impairment? What are the wrong lifestyle choices that people have made other than screen time that leads to visual impairment?
First of all, I would seek your permission to speak in Hindi. May I?
Yes, sir. Please go ahead.
Thank you. Now, talking about lifestyle, I remember from my childhood, my father used to say two things. One, when sorry, my English mein aa gaya. कि जब हम लोग पढ़ रहे होते थे तो विंटर में धूप में बैठे हुए और सनलाइट उस पर पड़ रही है और हम उसको कर रहे हैं, तो दैट इज द श्योर वे टू गेट ब्लाइंडनेस. And the very stupid thing that most children, millions of children are doing it day in and day out. I've been telling my children, my grandchildren, कि भैया धूप इस पे न पड़ने दो. You say even if you're sitting in the sun, enjoying the sunshine, किताब के ऊपर सनलाइट नहीं आनी चाहिए, because वो glare is blinding. तो कम से कम उसको कवर कर लो, अपनी बॉडी के शैडो से कवर कर लो. एक तो ये चीज, ये मिलियंस तक ये मैसेज पहुंचाने के लिए पूरी कम्युनिकेशन स्ट्रेटेजी बनाइए. इट्स वेरी इजी टू डू, नो प्रॉब्लम. सेकेंडली, हमने बच्चों को पढ़ते हुए देखा है, ये किताब ये लेके 6 inches away from the book or the paper. My father used to say, this is the formula, कि ये कम से कम इतना डिस्टेंस होना चाहिए. मैंने अपने ग्रैंड चाइल्ड को बताया, एक दफा में उसने सीख लिया इसे कि ये करो, बल्कि 99% चिल्ड्रन यूं पढ़ते हैं. एंड पेरेंट्स चूंकि खुद अनपढ़ और जाहिल हैं, हम लोग पॉइंट आउट नहीं करते. ये दो चीजें करा दीजिए, यू विल सी ए वर्ल्ड ऑफ डिफरेंस. ये और ये इसका कम्युनिकेशन स्कूलों में बच्चों में ये वेरी इजी टू डू. कोई एड एजेंसी इस पे बड़ा अच्छा एड बना सकती है. अच्छा, इसके अलावा ऑफकोर्स जो मोर टेक्निकल थिंग लाइक लाइफस्टाइल चेंजेस, डायबिटीज का क्या रोल है, ऑलरेडी आई एम श्योर आई हर्ड द डॉक्टर बिफोर मी पार्टली वो डायबिटीज का रोल है उसकी बताएं. टाइमली चेकअप. आई रिमेम्बर आई वाज डायरेक्टर सोशल वेलफेयर 40 years ago. एक हमको पार्शली साइटेड के लिए कैंपेन करने को कहा गया है. वो क्या था, स्कूल के टीचर्स को 2 घंटे की ट्रेनिंग दी गई, 2 घंटे की, कि बच्चों का टेस्ट कैसे लेते हैं, आई टेस्ट कैसे लेते हैं. नॉर्मल स्कूल टीचर्स, माइंड यू, नॉट द डॉक्टर. क्या करना है कि चार्ट जो है, जो ऑप्टिकल चार्ट जो हम हर हफ्ते किया था, वो दिखा दिया और 50 बच्चे क्लास में, बच्चों पढ़ो इसको. और उसमें हमने ये देखा कि 50 में से 40 ने पढ़ लिया लेकिन 10 ने नहीं पढ़ा. अच्छा, उन 10 में से ऐसे थे, 2-3 ऐसे थे जो उनकी आईसाइट कमजोर थी लेकिन उनको मालूम नहीं था. तो हमने उनको फ्रंट बेंच पे बिठा दिया. फ्रंट बेंच पे बिठा दिया तो वो देखने लग गए, क्योंकि जो ब्लैक बोर्ड पे टीचर लिखती थी वो उनको समझ में नहीं आता था, पढ़ते नहीं थे, और हम उनको डल एंड स्टूपिड डिक्लेयर कर देते थे कि बड़ा डल स्टूडेंट है, इसको कोई समझ में नहीं आता. वी डिडंट रियलाइज कि उस बेचारे को पढ़ा नहीं जा रहा कि लिखा हुआ क्या है उसके ऊपर. तो बड़ा सिंपल था कि सबसे पहले उसको आगे बिठा दो. बाकी जो 8 थे उनके हमने आई टेस्ट कराना था. आई को कराया. उस 8 में से 6 ऐसे थे कि जिनको ऐनक दे दो ठीक हो जाएंगे. 2 ऐसे थे जिनको डॉक्टर की जरूरत थी, डॉक्टर ने ट्रीट किया, 2 दिन में वो ठीक हो गया. It was so easy because 80% of blindness is preventable by a very simple thing that we need to be conscious about. अब ये जो screening है the school level now site से was of which I have been global chairman, India chairman for the last 9 years, and now finishing my term. तो उसमें हम स्कूल हेल्थ प्रोग्राम हमने टेकअप किया कि ये किधर भी ये करते हैं. 2 घंटे की ट्रेनिंग टीचर को दी. टीचर आइडेंटिफाई करता है जो बच्चे वीक आई साइट वाले थे उनको हम ऐनक दे देते हैं. ये इज एज सिंपल एज दैट. क्योंकि हमारे यहाँ जो है ब्लाइंडनेस, ब्लाइंड एंड पीपल विद प्रॉब्लम, इसमें 10 टाइप का फर्क है. You know, the 10% of the people with visual problem are actually blind, but 90% have eye problem which is treatable. और ट्रीटमेंट मैंने बता दिया कि कितनी सिंपल है. फिर हमने, पता नहीं आप लोगों को मालूम है नहीं, कि हम लोगों ने स्कीम चलाई थी राही नाम की, ट्रक ड्राइवर्स. हमको ये अंदाजा हुआ कि ट्रक ड्राइवर्स की आई साइट बिकॉज ऑफ द काइंड ऑफ ग्लेयर वगैरह ये फेस करते हैं, इनकी आई साइट खराब है. ट्रक ड्राइवर रात को होल्ड करने आएगा, हम उसका टेस्ट लेंगे और 10 दिन बाद वो जहां पे होगा वो अपना एड्रेस बता देगा कि आफ्टर 10 days आई विल बी ऑन सच एंड सच प्लेस. वहां उसको ऐनक डिलीवर हो जाएगी उसी की स्पेसिफिकेशन के. About 5 lakh drivers have already got this free spectacle, super treatment. And something which we don't know, people don't know, and we are not publicizing it deliberately. 48% of all the drivers were found with a defective vision. 48, and 23 people in person, not percentage, were actually blind, and they were driving with the help of a helper. हम इसको सीक्रेट इसलिए हमने रखा हुआ है कि जिस दिन ये पब्लिक हो गया, there will be huge public outcry, and the truck union जो हमारे साथ कोऑपरेट कर रही है वो हमसे दूर हो जाएगी कि भाई आप तो हमको बदनाम कर रहे हैं. तो हम किसी को बदनाम नहीं करना चाहते, लेकिन the fact, the gravity is such that 48% of all drivers have eye problem, and 99% of which is solvable by 250 रुपए की उनको स्पेक्स देंगे. हम 250 रुपए की फ्री स्पेक्टिकल उनको दे देते हैं. इतना क्वालिटी कर रहे हैं. हमारा टारगेट पूरे 9 मिलियन ड्राइवर्स को अगले 10 साल में पहुंचना है. देयर आर 9 मिलियन, वी वांट टू रीच ईच वन ऑफ देम. तो ये चीज है कि जो डेली चीज होगी, ये जो ब्लाइंडनेस इज ऑल अराउंड अस, it is 80% is preventable. That is the concept we have to dig into to people. और छोटे छोटे बच्चों को अगर ये जो मैंने दो चीजें शुरू में बताई थी, अगर वो हम पब्लिसाइज करें, I think we will make a lot of impact. I think like enough for me, because I have just taken leave from another meeting. But quick question, अगर ये कोई comment हो तो I'm here for another minute or two.
Sure, sir. Dr. Qureshi, हमें तो बताया जाता है कि पढ़ते समय लाइट अच्छी होनी चाहिए, क्योंकि अगर लाइट कम होती है तो आई स्ट्रेन होता है. इसलिए पेरेंट्स एक रीडिंग लाइट भी लेते हैं बच्चों के लिए, इंश्योर करते हैं कि लाइट ब्राइट हो जो वो पढ़ रहे हो. ये व्हाट इज दिस? इज दिस कॉन्ट्रडिक्टरी टू द नॉर्मल कंडीशनिंग वी हैव?
नहीं, ऑफ कोर्स, देखिए वो लाइट जो पढ़ने के लिए एडिक्वेट लाइट, वो उसको क्वांटिफाई करना, डिफाइन करना कि इतने ल्यूमेंस होंगे, इतने होंगे, ये करना तो मुश्किल है. ऑब्वियसली इट शुड बी ब्राइट एनफ जिसमें हमको पढ़ा जाए. अगर डार्क होगी तो उतनी आई पे स्ट्रेन होता है, ज्यादा ब्राइट होगी तो फिर ग्लेयर होगी. ये तो डॉक्टर साहबान अगर कोई डेफिनेशन निकाल सके तो अच्छा होगा, लेकिन जो हम कॉमन सेंस से समझते हैं कि लाइट शुड बी एडिक्वेट, जिसमें वी कैन रीड कंफर्टेबली. Because if it is less, it is strenuous. If it is too high, it is glaring, and that.
ऐसा changes वो ला सकते हैं.
ये मुझसे पूछ रही है, मुझे अगर आप फ्री कर दें पहले तो ठीक रहेगा. ठीक है.
Doctor,
especially this IT industry people and voracious readers, like we are aware of John Milton becoming blind because of his excessive reading. So those who constantly stare at glary things and IT screens, mobile now children, and I think people who are working in dusty places, these are some important occupations which can cause damage to the eyes, is what I have understood.
all right.
And
Can I just add? Can I just add
Yes,
to that?
yes,
In
yes,
occupations,
Dr.
I think Dr. Matesh has already mentioned the sports people. So that is really something, I think accidents and injuries are something which is preventable blindness. So simple things like wearing the seat belt, wearing the helmets, using protective glasses while playing high impact sports. And of course, the bow and arrow and crackers. So I'm so anti them because we see such terrible results. But you can't tell a child to stop playing, but you can at least make them wear, helmets, and seat belts are still not given enough importance in our country. So these are things, injuries while playing games should absolutely not be there. So we should be very careful about these. This is an occupational hazard which can be prevented.
And probably, even in the labs when they are testing, sometimes they look at the chemicals very closely. That can also cause if they don't wear protective glasses.
Dr. Anita, we've spoken about occupational risk. We've spoken about lifestyle changes that we need. Now, one of the big issues in our country is the increase in the prevalence of diabetes. And you're seeing even younger children now because of, more screen time, obesity, diabetes. Does that affect eyesight? Because, most people think, diabetes, sugar, monitor your sugar, treat it, keep it under control. At a young age, can diabetes cause visual impairment? Does it affect eye health? what can be done as a lifestyle change to reduce the impact of diabetes on eye health?
So diabetes really impacts the eye health. Not all diabetics, but definitely after 5 to 10 years of diabetes, or maybe earlier if it is uncontrolled, you will develop the many patients will develop the complications of diabetes, which can be irreversible blindness also in the eyes, heart attacks, strokes, kidney failure. So diabetes is a really terrible disease, and the problem is that we are getting it at much younger ages. Childhood obesity is one contributing factor. If you have a family history already, you are already with a very big risk factor, and it is so important that you're really careful with your diet. And the problem is that young people believe hame kuch nahi hoga. This is only going to happen to us when we are old. So they really ignore it, and unfortunately, diabetes doesn't always have symptoms. You think I'm having my medicine, it's probably controlled, and then you get a blood test done and you find that it's just all over the place. We have young people in their 40s coming for cataract, and I'm asking them, why do you have cataract? Do you have diabetes? No. You get the blood sugars done, 300, 400, happily they're roaming around. So diabetes does affect the eye, and sometimes we can pick up diabetes because of the eye. And it is very, very important once you get diabetes, especially in the young age, when you have 30, 40 years ahead of you. When you are young, you can still make the lifestyle changes. At 70 or 80, when I'm telling someone, please go for a walk every day, don't eat the halwa that you've enjoyed all through your life, it's not that relevant then. It is much more relevant earlier on. So it has to be prevented. Once you have diabetes, eventually a large number are going to end up with eye complications, heart complications, kidney complications. So diabetes must be prevented wherever you can prevent it.
Dr. Jolly, can the risk of macular degeneration and glaucoma be reduced by regular exercise and diet?
Yes, to some extent, because diet modification. As diet modification in the sense more antioxidants in the diet, more green leafy vegetables and fruits, they do have an effect on decreasing the chances of getting macular degeneration. Because one of the treatment which we are giving to patients consists of antioxidants. So it is better to have antioxidants in directly from food rather than taking tablets each day. So there are some amount of like green leafy vegetables are there, some citrus fruits, pomegranate, some all colored fruits and vegetables. They are rich in antioxidants. So antioxidants will be, they do have a role in decreasing the incidence or maybe keeping that macular degeneration, especially the one, there are two types. One is that it is a wet type, which progresses like anything, you have to take medication, some treatment for it. But the dry type definitely has a role, the antioxidants have a role. So you can do that. And of course, exercising regularly 30 minutes a day will be good for anything. So even for glaucoma, people have one is antioxidants which they are giving. Secondly, a regular exercise. They are advocating that it does help. And then certain things like yoga and some very excessive exercise like weightlifting. You have to be very cautious in patients who are either having glaucoma or having a family history of glaucoma, because they are likely to cause a transient increase in the pressure of the eye, and that can harm a person who has already having glaucoma. Similarly, drinking too much water or any fluid in a very short interval of time, that is another very important thing which can worsen your glaucoma. So there may be a lot of things that a person, when we are treating early glaucoma, some people progress to advanced glaucoma and some remain healthy throughout life. And these are the factors which I think we should look into, that are they doing something very strenuous which may cause problems or their diet is not proper, or they may be having this omega-3 fatty acids is supposed to be very good for most of the diseases like macular degeneration, even for glaucoma, they have said it is good. Then you have this thing, caffeine. Caffeine is another thing which excessive caffeine can cause worsening of your glaucoma. And red wine may have a positive effect, but of course it has not been advocated because there are not many studies which are for red wine. And mild aerobic exercises, they improve your circulation, they improve your systemic blood pressure, they improve the perfusion of your optic nerve, which is important in glaucoma. So they are, they should be done. So this is, one more thing is this swimming. Swimming also causes a transient increase in intraocular pressure. That means they are not good for glaucoma. So you have to be careful. Sleeping habit, if you are sleeping with your head down, that can transiently increase your intraocular pressure. So they are, and of course, smoking. Smoking is something which is bad for diabetics, bad for macular degeneration. It is bad for glaucoma. It is involved in almost everything that we have. So
Dr. Anita, right. Dr. Anita, should doctors be counseling those patients who come to them with heavy smoking and alcohol use to be more vigilant about their eye health?
Absolutely. I'm quite famous for it. My diabetes lecture goes to every diabetic. Smoking, so there is just nothing good about it. And definitely, I feel it contributes to even Alzheimer's, all the degenerative diseases. So there are toxins in these smoking and even tobacco and all of that. The chewing, tobacco, pan masala. So all these chemicals are going to have some effect on your body, especially the nerves, and then we can't treat nerve damage. So we have to prevent it. And even one more thing that I didn't add earlier was the preservatives. In the growing age, we have no idea what these chemicals are doing to the body. So I think it's really important. I also tell the children, no junk food, and of course eat healthy, but you have to be judicious. Na itna to nahi koi sabzi khata hai bacha. So give them a little bit, tell them like junk food once a week, and then also balance it. I feel as a doctor, we need to also counsel. So diabetic patients we counsel, and anyway, when the children come, their parents only want to know whose fault is it that the child has glasses and what can whose favorite is really a strange and silly question. I can just blame it on the mobiles and the screens. But there is some genetic predisposition, but mainly I think environment factors are taking over quite a bit more than just the genetic factors. So we can only counsel to modify the genetic factors, obviously. And if you have the time in the OPD, I know in many of the busy OPDs, doctors don't always have the time. But whenever I have the time, I definitely try to counsel as much as possible. Because we don't want to see blindness at all, and neither do we want to see the other complications. So yes, I feel if we can counsel, we should be able to do it.
Dr. Mantesh, does good hand hygiene play any role in good vision? Because in our country now there has been a focus on sanitation and improvement in facilities. So if you're not touching your eyes with dirty hands all the time, will that actually improve or lessen visual impairment in our country?
Yeah, certainly, because hygienic conditions always prevents a lot of challenges, along with especially sight and so many other health disorders could be prevented by keeping surroundings and the place where you live and the atmosphere around you, and also educating kids to keep their palms clean and drinking good water, like we mentioned about the swimming, air. So that will definitely prevent or reduce the sight deterioration. And we organize a lot of cricket for the blind. So in blind cricket teams, out of 11 members, only 4 are completely blind. The rest of the 7 people can see some, if not completely. So we keep educating them to manage their sight, whatever sight they have, limited sight they have to maintain it. So they have to put protective gears to reduce from becoming completely blind. So definitely it helps in a big way, and they can stay whatever sight they have, it can be restored. Even for completely sighted people, it is very, very important. I feel the hygienic conditions, even the food, or touching the eyes. If we can tell children, especially, and some adults also, I've heard about it is a habit they keep touching. So we should tell them not to repeatedly do that.
Dr. Anita, would you like to talk about corneal blindness and how much of the incidents you see in our country can that be helped if people be donating their eyes? Is there any hesitancy to do that? Could you talk about this?
Yeah, I'd just like to add to what Dr. Mahantesh said, that yes, one good thing from COVID is now an awareness of hand hygiene, and I think that's really something good. So many eye infections which can lead to blindness can be prevented, and yes, rubbing the eyes again leads to infection. So this is the one good thing, that people are now a little bit more aware of the hygiene and not to touch and rub their eyes. In predisposed people, rubbing the eyes can lead to a condition called keratoconus, which can be very, very visually debilitating. So this hand hygiene, not touching the eyes, not rubbing the eyes, is a really good thing. And coming to corneal blindness, I'm not a cornea specialist myself, but we just see that there are so many corneal blind, and our number of donations are really, really inadequate. And I think lack of awareness, and people do not understand that the corneal donation is after you are dead, and so it is not going to harm you anyway. It is a part of the body that you no longer need. But unless that donation, or that the fact that you want to donate is known in time to your loved ones, that it doesn't happen. And one donation can save or restore sight to almost up to 4 to 5 blind people. The waiting lists are really long, and Dr. Jolly would know, the government hospitals have these huge waiting lists, and the children are supposed to be on priority because you want to prevent a lazy eye or amblyopia by at least giving them vision in one eye. But I think people are just not aware, and if they are aware, I think North India is unfortunately the worst. They just don't want to donate. My daughter in college did a survey, and she was collecting pledge cards. So the way we create awareness is that we ask people while they're alive to pledge their eyes, to say that, yes, I want to donate. Because once you are dead, even if you wanted to, if you don't tell anybody beforehand, that's not going to happen. So she just went around collecting pledge cards. People were they didn't want to even pledge their eyes. If I pledge my eyes, you'll come and kill me and take my eyes. Ridiculous kind of statements also come out. So people should know that you donate your eyes and somebody else will see after you've gone. Your eyes live on. It's such a noble donation. So I don't know. I know from time to time people do try to. We have a cornea donation fortnight also in September. But somehow the message is still not enough. And in the hospital, we try to run a hospital cornea retrieval program, that our grief counselors go to the patients who have passed away and they try to counsel them. But it's a very hard job because obviously they're already in grief. And very few people turn around and say yes. Most of them say, why are you asking for this? And this is, they just feel that you're trying to attack them or something like that.
Mm-hmm. So that's an important issue of eye donation and how it can benefit those who are visually impaired. Dr. Jolly, would you like to say a few things in conclusion? What are the 1, 2, 3 lifestyle changes that people can make, children and adults, to improve their visual health?
So it will be, I think, first is that, we have to think of lifestyle modification as an important part of the treatment. Because, we are, as doctors also, we are into just giving drugs to the patient. And only drugs and drugs. So lifestyle has to be a part of our counseling to the patient. That lifestyle in the form of proper diet, proper exercises, as Dr. Anita said, that all those trash which we are eating, fast food, etc., that should not be there. Regular eye checkups, that is very important, especially when she mentioned that, at every stage, there should be a eye checkup. Like you are going to school, there should be one. Going to college, going for a job. And in job also, there should be a regular eye checkup for all patients, because a lot of things are silent disease. And it is only that if we pick them up early, we are able to treat them in time so that they don't result in blindness. So that is the second thing. And the third one is, of course, exercise. Exercise is being found to be important for almost all diseases of the body, including the eye diseases, glaucoma, and etc. And of course, in diabetics is a very, very big field now. And there are lots and lots of people who are diabetic. Unfortunately, it is totally asymptomatic till the time the patient develops complications. And at that time, it is very little which we can do for them. So I would like that people should be aware of these eye diseases and should take examination of eyes very seriously, especially for the children and for the older people, means above 60, and small children. They are the ones who are needing maximum eye care.
All right. Thank you so much, Dr. Jolly, Dr. Anita, Dr. Qureshi, Dr. Mantesh. Thank you all for joining us on this special show to commemorate the Blindness Week. And we hope that the message will get across that lifestyle choices do impact visual health. These are steps you can take to ensure that you can enjoy and appreciate all that you see through your eyes and are able to prevent a visual impairment and blindness, which is something that can be done. Thank you all for joining us on ISW Council's campaign, which is the Blindness Prevention Week 2023. Thank you.
Thank you.
Thank you.
Thank you.
Thank you.